Well, obviously, when you talk about cell culture and expansion and all the biological processes and cell therapy manufacturing, it's so manual, and so much of it is art and technique. And then once you get to the tech transfer phase of your project, it becomes really difficult to make sure that you've got a reliable, repeatable, and robust process. Now, if you add that the variability within the clinic, you're just really risking knowing whether or not a failure is due to your process or the product. We really think that as soon as you're at the endpoints of proof of concept and are beginning to look towards your clinical uh, program is when you need to start implementing improvements in your processes. It really needs to be robust and reproducible at that point. The other aspect of that is there are a lot of similarities out there in all the projects and products that are being manufactured, similarities in techniques and even targets. And so if you have a process that's way more reliable than a lot of the other competitors, you end up with a higher value product that's easier to transfer. But regardless, before you start your clinical program, it really makes sense to have as many automations and improvements in that process. At this point, there are a lot of good vendors out there servicing the cell and gene therapy industry and some really good systems that perform unit operations. What we're trying to do is close the gap between those operations and provide a system and tools that can help bring GMP to earlier phase development. For example, a lot of times transfer between operations is manual and there are no electronic batch records. And we believe connecting those operations can be done just like it would be in a commercial stage in early development. We've been really excited about the launch this year of Signata CT-5. It's such a simple and yet powerful system that has the capacity to grow into a lot of different parts of a manufacturing process. The device is designed to be inherently flexible with a lot of user control, a lot of ability to change the flow and the dynamics of what it's performing. We started with fill and formulation because that fits very well with our portfolio of products, but we've already launched with additional consumables that allow you to use bags as a final container or different types of mixing units. As we go along, we've been adding different operations, working directly with customers to develop additional capabilities of the system. We really have a vision that this is going to be a workhorse of integration at the scale out level of cell therapy manufacturing.